Mikhail, you mentioned the technology, and I have to talk about the technology. So coordinating the activities, coordinating the information flow, is this something that you guys just give the community workers access to? And is it an Intermountain program that you guys support and maintain for the larger community?
So I'll first provide a little bit of context that's tied to what Bill just said. When we defined our aspiration for trying to improve health in this way, we listened to what gets in the way of sectors working together. And one of the first things we heard in our listening to our process was we need a way to communicate with one another. We have this great resource in 211 where each of our services are listed, if you will. There's a great directory. People know those resources exist, but we don't have a way to know that when we refer Bill to the food bank to get some food for the week, and we're trying to coordinate some job retraining, we don't know if those issues get solved. We only stay in our silo. We ask for something, we refer something, and then we continue to follow the issue we're managing. And so what our colleagues asked us from other sectors was give us a way to communicate with one another that also protects the privacy of the person that we're serving. Because if we ever violate the privacy of the individual we're trying to help, then we're cut off from our opportunity to help. So we partnered with Unite Us to bring a platform to our communities. They have a lot of experience doing this, and it is essentially a network that builds on the knowledge that exists in the 211 directory resource, but then puts each of the service providers on board that network so that they can communicate with others in the network. And then there's a consent process for the individual that we're looking to serve. They have to consent to have their information shared. And then community health workers are using that platform to connect the others involved in care and coordinating services. And it allows us to do a couple of things. One, we get to coordinate for that individual. We also get to understand our network. How often do we have people aligned with the work that are needed to solve the problems we've identified? And when do we have to find someone that we're not already working with closely? And then we can actually, over time, measure the performance of that network. And making that leap in healthcare to thinking about how we manage a network of skilled nursing facilities and specialists and primary care physicians and hospitals that are all involved in the continuum of care, we're now beginning to manage a network, if you will, of cross-sector partners in serving a community. And that gives us different ways to think about how we redesign that network to better meet the needs over time.